Welcome back YouTubers to my channel of an everyday life up in Aspie. If you're following me right now, at this point of time basically I am sharing with you all the medication side effects and the different types that is used for different everyday mental health disorders and just the like, basically, be it depression, anxiety, epilepsy, and all the behavioural ones that I'm hoping to maybe address. I may have missed out a few here, but feel free to maybe, as I said, comment below and just bear with me. Also, I humbly apologise in advance. And also, basically, I'm AspieAnswersAll. Basically, I welcome the newbies and all boys alike, you basically. And also, that's put a disclaimer out there. I'm no medical professional. I'm just everyday Joe blogs, basically just sharing my life story and creating an awareness and understanding for you all about my life story with AS, OCD, depression and the like. Also, to create a mental health awareness series. No further ado, basically, in the last part of this chapter, or shall we say the last part of the series, I was talking about in the anxiety medication was basically the question of decisions of is the anti-anxiety medications or anxiety medications right for me. And like, I listed some of the questions you could ask your medical professional as well as your counsellor or whoever you're with to see if basically it's right for you. And all further ado, this is the last part of my series of the anxiety medication, hopefully, and this is hopefully just going to give you some tips and advice and guidelines of it all, just to hopefully give you a clearer understanding. As we know, medication alone isn't enough, okay? We need to remember that with everyday medications, be it the anxiety, depression, and the like, there's no cure or quick fix, as they call it. Yes, anxiety, depression, and the like can be manageable and tolerable to a point where we can use other, coping mechanisms and all this that can be able to, help us with these classic signs and symptoms of all these everyday mental health disorders that we suffer from today. Certain medications may treat some symptoms of anxiety, however, but as you've got to remember, it can't always change the underlying issues that came in it, or even the everyday situations in our life that is making us anxious. Anxiety medication, excuse my tongue, won't solve your problems if you're anxious though. Why is this? You may be, for example, to give you a classic one, is because of the mounting bills, a tendency to jump to the worst case scenario is, or the unhealthy relationship that you're with, maybe, I don't know. That's where therapy and other lifestyle changes that needs to come in, be it eating right, sleeping right, cognitive behavioural therapy, counselling, and every other therapies out there that I can't think of right now, but those should be the ones you should be thinking on, actually maybe balancing up. As we know, basically, there are alternative treatments and therapy plans from the medication if you want to slowly withdraw yourself off, basically. This can include the cognitive behaviour thinking, therapy, which is widely accepted to be more effective for anxiety than drugs. To overcome anxiety for good, however, though, you may also need to make some major changes in your life. Like I said, the everyday lifestyle changes that you can make in your anxieties could include, changing your eating patterns, eating healthier, eating 3 times a day, drinking water, exercise, basically. Do as much exercise if you want to, depending on you, having the right amount of sleep, getting back into the routine of maybe going to bed early if you've been going to bed so late, say, stay up late till about 2 a.m. in the morning and, you're still buzzing around and you feel tired and whatnot. Another one is basically, rather than that, if you were going to bed early, you can maybe go in an hour later, but bear in mind that you might have to try and figure out how you're going to fit in your 7 to 8 hours of sleep every night. Other effective treatments that may help with anxiety is talk therapy, meditation, be it yoga, Buddhism or what have you, biofeedback, hypnosis and acupuncture. Just bear in mind some of these treatments may work for some people and may not for others. So it's just about finding the balance which works for you versus not for you, as again opposed to what I shared earlier in the piece about balancing up the pros and cons on your medications, knowing the classical signs and symptoms versus, are you ready and willing enough to slowly withdraw off your medication of this and more. As we know, the main advantage for the non-drug treatments for anxiety is that they can produce lasting, longer effects and changes in the long-term relief. If your anxiety is so severe, however, that it may interfere with your therapy, medication may be useful in short term to get your symptoms under control. Once it is at a manageable level, kilter with you, other forms of behaviour and talk therapy can be successfully pursued later on once you're fully, ready. There is a time that you need to know when you're ready and whatnot. Many people may question, well, how do you know when you're ready? It's all about, setting up some boundaries for yourself and also maybe some rules for yourself, of what you want to achieve as well as versus your goals, I should say. And just, make sure that you stick with them, and hopefully maybe, when your breathing's at ease and everything else, that you're ready to take that step. Guidelines for taking for these anxiety medication. If you do decide to take medication for your anxiety disorder, bear in mind to learn all you can about your prescription. Again, knowing the pros and cons, weighing up, what's best for you and what's not best for you. Sometimes people just go shebang, thinking, oh, this anti-anxiety drug is cool. And then, like I said, the classic one is the addiction or substance abuse on certain prescription drugs, be it anxiety drugs or what have you. Another one is just to take it as directed by a medical professional. Sometimes, we tend to forget to take our medication at the right times and what have you, and then it doesn't take the effect of what needs to be done and dealt with. But bear in mind, the more you know about your anti-anxiety, or shall we say your anxiety medication, I should say, the better equipped and ready you'll be able to identify with the side effects, as well as dealing with these side effects that is classically known in most of those anxiety, medications I shared so far, as well as avoiding any drug interactions or minimising any other medication or risk. But yet, sometimes some medications don't expect you to maybe take while you're driving or doing anything that's going to be physical activity. Basically, be it, maybe say you want to power glide over the cliff or whatever they call them, those power gliders, just tread with care and know what you're needing to do. But also, I want to kind of give you some tips in here, or some suggestions or guidance here, basically, when you decide to take your medications. First and foremost, number one is be patient. It will take some time for some anti-anxiety medications to take effect into your system to reach their full therapeutic effect on you. While you may want immediate relief, however, it's important to have the realistic expectations of what you really need to achieve here. You will need to work closely with your doctor to find the right dosage, as well as basically evaluating the anxiety drug's effectiveness of basically what's there and what's not. Number two, obviously, is no-brainer. Avoid the alcohol consumption while you're on these sort of medications, or just any medications that I've addressed so far. Alcohol anxiety, basically, medication can cause poor coordination, poor cognitive thinking. It will increase the risk of basically motor vehicle accidents as well as any other injuries. Number three, monitor your medication response. That's another important one, I feel. Keep a journal somewhere, monitor your progress of, your medication if need be, basically, so that you know the signs and symptoms. Maybe if you're in a pain threshold, basically, just note down also any of the changes that's going on in your system, be it physical and emotional, of what you're experiencing. But again, here is everyone reacts differently to certain medications, so it's always impossible to predict the actual side effects you will be having or how well your anxiety will work. If you're taking benzodiazepines, the Valium, Xanax, etc., don't drive or operate heavy machinery until you know how the drug is affecting you. It's a classic no-no. Again, it's like I said, knowing what's best for you. Number number 4 I think I'm up to is talk to your doctor. Be open about what you're taking, and you know, be open and honest about any of the side effects that of these classical anxiety is causing for you. You know, don't be afraid to discuss the problems or concerns with your doctor. They're there to help you. Obviously, they're there to try and find the right, you know, medication, right dosage and whatnot for you. They want to make sure that first and foremost your health is in check and that you're doing everyday things that will change for the better. Well, you should never stop your anxiety medication, however, you know, without talking to your doctor first. Ultimately, the decision is up to you though, however. But sometimes it feels, like I said, it's important maybe to talk it out with your doctor and then sway it up, you know, weigh up again, pros and cons about, do you want to take yourself off these anxiety tablets that you're on, or do you want to continue it on? If you're unhappy with how the pills make you feel, ask your doctor nicely how to actually wean off them, or find another alternative, or just maybe, like as I said before, some other therapies, be it, you know, what have you. And last but not least is no-brainer. Continue your therapy of whatever it may be that was helping to, you know, keep your anxiety levels to a low. You know, certain medication can control the symptoms of anxiety, but not all. But it doesn't, again, obviously treat the underlying problem of your everyday issues that you may be facing in your everyday life. Sometimes you need to sit down and meditate and question to yourself, you know, why it was happening in the first place, the how, what, why, where, when, and all that, you know, but try not to dwell on them for too long though. Therefore, it's crucial to pursue your therapy of what you're doing, or any other form of anxiety treatment that you have been doing. Therapy can help you get to the root of your anxiety problem and develop better coping skills, however. And they're basically with that in mind, that you can live a healthier life with other alternatives besides, you know, being on the medications and whatnot. Like I said before in one of my videos, there's certain medications I just forbid taking or what have you, due to what I've shared hopefully briefly in my little piece about why it is, and that was my choice of it all. And you know, many people may not accept my decision, and it will go for you guys that whatever decision you do with these medications you're taking, you know, if they don't want to, you know, either A, accept your decision, that's their problem obviously, and you need to find the right support network and help out there for yourself, so that hopefully yes, it can be hard at times and difficult at this time when you're taking these medications or whatever it may be, you know, at this point, you know, but eventually it will get better. It's just a timely thing like anything, you know, and it's about making sure that we're happy in ourselves and whatnot. So in all further ado, basically guys, that ends basically my anxiety medication part of the series. Give me a like for thumbs up and engagement. Also feel free to comment below of any, you know, experiences that you've had on maybe certain medications I've introduced so far, or just basically share your story if you want to. Be open about it. If you don't want to, that's fine, you know, it's your choice. Fact, I'm not going to push it, even though like I said, I'm all about creating awareness, understanding and everything on my channel. So no further ado, follow me on Twitter and Facebook, AspieAnswersAll. Just even private message me up there on Facebook, AspieAnswersAll, if you feel to either A, talk of events, you know, or B, you want some sort of everyday topic that you want me to address, sort of thing, to the viewers. Also, love what you do what you love one another if you can. Forgive one another, basically, and also love yourself, more importantly, and forgive yourself. And basically, in all further ado, you know, I'll see you again soon. Thanks for watching.